One thing I don't think we talk about enough as child and teen therapists is how you even talk to your kids about going to therapy, and also how can you make it the most helpful as possible once they're actually in therapy. So, I wanted to share a few quick tips. One is to not talk about therapy as a negative thing or a consequence, but more of a solution or supportive service that you can involve in your child's life to help them achieve their goals. Similar to, sending a kid for extra batting practice if they really want to be a good baseball player. Sending them to us when they're struggling to manage their mood, anxiety, relationship challenges, behavior perhaps, attention. All of those things can be framed in the exact same way so they can feel more comfortable coming to therapy and less like there is something wrong with them. And that is the key, is really that we don't want to frame therapy as a punishment, as a consequence, as anything other than a supportive, helpful service. And once they're in therapy, the best thing you can do as a parent is you can stay out of it to some extent. And I'm going to explain a little bit further, but as a parent, you really want to create this space as your child's space, but make sure that you are checking in with the therapist, that you are involved, but not always so that the child is super aware that you're involved. You might share information or just kind of say, these are some of the things I'm noticing around the house, either improvements or challenges, so that the therapist has the full picture, because children will never provide us with the full picture. But you're going to create it as a space that is your child's and not a space where you go in and complain or talk negatively about them. It needs to be a supportive space for this to work. Thanks so much.